What's up, guys? I'm Sarah.
And I'm Haley.
And we're
the Device Girls. Our mission for our podcast is to inspire and empower,
educate, and learn all about the medical and healthcare industry as a whole.
So tune in, and we hope you enjoy this episode.
What's up, guys? Welcome back to the Device Girls podcast. Today we have on a very special guest and dear friend of mine. We have been besties since middle school, and I am so excited to have Raegan Byington on with us today. She is a former L&D nurse, travel nurse, now ICU nurse, and she's going to spill all the tea today from her wonderful years of experience. She is an Aggie, so Haley's like on cloud 9 right now. Yep. So Raegan, let's introduce yourself. Thank you so much for coming on today.
Well, thank you for having me. This is exciting.
So exciting.
Yes.
So, okay, tell the audience a little bit about your upbringing, where you grew up, and then your journey into becoming a nurse.
Okay. So I grew up here in Abilene, was here since I was 2. And then I always liked science. In school, I was just a nerd, like loved biology and stuff. So I knew I wanted to do something
That's
medical.
What I tell people.
Yes. I wanted to do something medical. And then my mom and I I always wanted to go to A&M. So my mom and I went there before I graduated. Mm-hmm. And then I learned about like the allied health degree that could lead into nursing. And so it just made sense. Like, honestly, nursing has been like the only thing that's been like straightforward in my path of life. Yeah. So it's all worked out really well.
No, for real. Raegan used to be like my saving grace in high school with algebra. Gosh, what was her name? Mrs. Our Algebra 2 class.
Yep. I know who you're talking about.
I saw her at the grocery store the other day.
Starts with an E.
Yes. I can't
think of her.
But she was like my saving grace in all hard subjects that Sarah was not as great as Raegan.
And well, I need Sarah to have fun, and she brings the party, so it's all good. We balance each other out.
I was more like the distraction.
Oh, yeah. Let's have a good balance.
Yeah, it's fun. Yes. It's fun. Okay, so then walk us through A&M, your journey at A&M. I know you loved A&M.
Yes, what drew you to A&M, first of all?
Well, my dad played baseball as an Aggie baseball player, and then he went professional, and my mom went there. That's where they met. And so, I was just brainwashed from birth to go there. But I loved it. We grew up going to football games, and that was like my one dream, go to A&M. And then when I graduated, I was like, what do I do after this? Yeah. But yeah, I started out with a health degree because that's where you get all your prerequisites for nursing. And then I put all my eggs in one basket and just applied to A&M's nursing school, like no other nursing school.
Yes, ma'am.
Yep. And and I got in, I don't know, by the grace of God. And
that does not surprise me at all.
I don't know. I had, I guess, a pretty high GPA, but I didn't have like any hospital life experience. So that was kind of hard when I first started being a nurse. But,
really?
Mm-hmm.
You didn't do any shadowing or any like PCT type of program or anything like that?
No.
You don't have to do any hours for nursing school?
No, they encouraged you to either have like a really high GPA like for acceptance or to have like a lot of hours shadowing. And I had done a little bit in the ER, but not very much, maybe like 2 shifts. And so I kind of just focused on my grades, and I guess that's how I got in.
Okay.
Because I didn't really have real life experience.
Yeah.
But that's like so beneficial. Or you can go, yeah.
Do you think it would have changed anything for you?
Maybe like made me feel more comfortable with just like hospital.
Yeah.
The way that things go in the hospital, or like just giving a patient a bed bath, and because like you learn that in school, but it's all like on mannequins. Yeah. And sometimes you don't practice it all, and so it's like in real life you're like, what do I do? Yeah. It's just. Yeah. So it's like little things like that. It's like you have all the knowledge like to be a nurse.
Yeah.
But
what was the nursing school program and curriculum like for you? I mean, did you have a really good experience in nursing school? Did you like their program?
I did. I loved it. All the professors were really like encouraging of our growth. I met like some really good friends in nursing school. I had a great experience.
That's awesome.
My mom went to another nursing school and did not have such a good experience. And so I was like, wow, I just realized how good of experience I did have at A&M. Yeah. It was great. I would do it all over again if I could. Yeah.
Yeah. Her mom actually just went back to school to become a nurse. How long ago was it?
Gosh, it's been a few years, maybe like 3 or 4 years.
Yeah.
Yep.
So awesome.
Yeah.
You inspired her.
I guess maybe.
Does she work with you now?
No, she did like ER type stuff, and then they moved. So
okay,
yeah, we never worked together. But
did you want to work with your mom?
Probably not. I feel like that would be a major distraction.
I could kind of see that. I went to school with. It was like a freaking family reunion on campus, actually, because at one point it was my sister's senior year, my mom. Senior year.
Oh, I forgot your mom went to McMurray.
And then in my sophomore year, I think. And then my dad, of course, is a professor. So I was like, oh, dear gosh. Can't get rid of people. No, I'm just kidding. But we were all, and I'd have like friends be like, hey, invite your mom to this party tonight. Your mom's crazy. Like my spirit animal. I'm like, absolutely not. This is not okay. She just loved my mom.
I mean, your mom's amazing.
Yeah,
I love her.
Yeah, I think that would be really hard to work with your mom.
Yes.
Well, not with your mom, like with a mom.
With a family member.
Yes.
Yeah, I don't know how I guess husband and wife is different, but a lot of nurses are like married, and so that's an interesting
to dynamic. Somebody like on the floor.
Mm-hmm. Yeah.
Oh, interesting.
So yeah,
is that a good dynamic?
I don't want to see you that much. Seeing you at home is enough. Okay.
Yes,
that's funny.
Yeah. I don't know if I could do that.
So then you decided to become an L&D nurse, right? Yes. So what drove you to L&D? Why?
I did L&D right off the bat.
Okay.
I loved learning about it in school. I loved it. I loved studying for it. It was just like so fun. Everything made sense to me. In nursing school, I was really overwhelmed by like med-surg type floors and patients, because you'd have like 5 or 6 patients. They'd have all these different medical diagnoses and all these meds for each patient. I just didn't understand how anyone time managed that. Mm-hmm. And so L&D is more of a specialty, and you have like when you're laboring a patient, it's typically one-on-one.
Right.
And so I kind of felt like that was more my personality. I loved moms and babies, and I was like, well, I can kind of hone in and focus on this. Mm-hmm. And that felt more comfortable to me. Mm-hmm. And then I loved babies, but I also like encouraging and like talking to the women and the moms. So that's why I chose L&D as opposed to like NICU.
Okay. So fun fact, Raegan helped deliver Sloan. And she was the best L&D nurse, actually. Aww. Yes.
You're partial.
I am partial. But you really were. She was just like your bedside manner, and you're so encouraging and kind and just like gentle. Like, I don't know. I mean, for me, that was like a little bit terrifying. Yeah. I did have an epidural. So that was my personal choice. And it was the best decision ever. My husband was actually like, Raegan, is she going to be able to take care of this baby? Like, she was like lights out. And no, I did fine. Pushed for 2 hours.
She did amazing.
We played tug of war. Mm-hmm. I used a mirror for progress, which is not that great because there's really not progress till the very end.
Yes, that's true.
It was a little discouraging, but it's okay.
She did so good. It was kind of a long time of pushing, but that's normal.
It was a long time of pushing.
For first-time moms.
Yeah.
2 hours.
2 hours.
Yeah. Sometimes it can be quicker than that. But.
Yeah. And then my mom, oh my gosh, my husband, because I had one side of my body, my epidural stopped working. So I was having feeling, but like weird feeling. It wasn't, and like some pain. And so I was for some reason pushing on both my mom, and instead of stirrups, why did we do that?
Yeah, I don't remember. I don't know.
I was like pushing on their forearms, and my mom kept getting so tired, so she'd drop her arm, and it was like the most OCD. I could not. I'm like, Mom, I need you to raise your arm. It needs to be level with Dustin's. I'm like, this is throwing me off.
It's like you need it to be a certain way.
But
yeah, those moments are like intense. So kind of everything goes,
It does.
I've seen people bite their significant other, like when they're pushing. Yeah.
Why? Because they're in so much pain.
Like bite their arm.
Give them a rag or something.
I know. Yeah.
Like, do we need a chew toy?
Maybe.
Oh my gosh.
There's some crazy stuff that happens.
Wow. What is like your most...
what's your craziest story?
Yeah, wild L&D story.
Well, L&D is wild. Like, it is like the Wild West because there's just people that come in and drop babies, and it's a lot of fun. But I was able to deliver a baby on my own before I left, which normally we don't like that to happen. Like, we want the doctors to be there to deliver the baby. But I always kind of, when you work there a while, you kind of want that experience of like,
the doctor doesn't get here fast
enough.
Yeah.
So I did that before I left. It happened when I had like a student with me, and it was just kind of a crazy situation. Like I went to leave the room to call the doctor because that's just how we did it. I probably should have called her from my cell in the room, but I was trying not to be unprofessional.
Yeah.
And so I went out to call her, and I had to like walk down the hall to call her for delivery. And then the husband like stuck out his head in the hallway and got my student and said like, the baby's coming. And then I just had to run in there and like deliver the baby, which is pretty easy to do when the baby's just coming.
Yeah.
But sometimes there's things that happen during delivery that you don't want to be in that. You want a doctor to be in that spot. But it was cool that I got to do that.
Yeah.
Cool. Yeah.
That's so cool.
That's awesome. Yeah. Congratulations.
Does that happen a lot?
Probably more often than you would think. Yeah.
Yeah.
Well,
because
like
the doctor's off doing something else and you can't plan that.
Yeah.
Yeah.
It's not like a scheduled procedure of like, hey, we're going to cut you open at this time. No.
Yep.
Right.
Baby just pops out.
Babies are on their own time for sure.
And then like GYNs, I mean, OBs, sometimes they're in surgeries. And I mean, like, it's just wild. I feel like that's a specialty where they are just sprinting all the time, just back and forth. Like,
or they're not even at the hospital; they're in clinic.
Yeah,
and one of their
chaos.
That's where, because Mascaro and Zimmerman moved. They were in the building of Hendrick, and they moved when they started their own practice, and so we would have to like make the transition of giving them more time to call them, like giving them more time to get over
just
the
running
hospital.
across.
Yeah.
Yes.
From the Jones building. Yeah.
Yes.
Yeah.
And Tadvik, he was like the runner doctor. Like you'd always see him sprint through the hallways. Like he never missed his deliveries. So yeah.
Well, so what's funny is like, because I'm sure that a lot of the doctors here are like super close to the hospital that are OBs, but like in Dallas, it's not that way. But actually, the town that I grew up in Rockwall, my OB, and then there's like one kind of across the street from them. They're both like super close to the hospital. So I'm like, they planned that well, but I don't know.
In bigger cities, I'm sure it's the proximity.
Can't all be right next to the hospital.
Yeah. Do you feel like patients get more nerve-wracked when their doctor's not there, or like this person that they've come up with this whole birthing plan and they're thinking, this is who's delivering my baby?
Yes.
Do you feel like it's like a stressful, wait, no, this person's supposed to deliver my baby, or this isn't exactly, do you see that a lot?
Yeah. When they come in, a lot of times if they're being induced or if they come in labor, they want to know like, especially like if they're not scheduled and they just come in labor, they're like, what doctor's on if it's the weekend? And so like they kind of want to, I think the ladies know that they might not deliver with their doctor. And so that is like a stressor. But by the time they're ready to have the baby, a lot of times the women are like, just whoever can deliver. Like they're not like that upset because there's just other important stuff going on.
And they're in a lot of pain.
Yes.
Oh yeah.
Sometimes.
Sure.
I mean, sometimes epidurals work really well. But
Would you have an epidural? Would y'all have epidurals?
Yeah, but actually, so
like, no question.
My mom, though, with my oldest brother, she had to have an emergency C-section because the umbilical cord was wrapped around his neck and it wouldn't come undone. Like every time she pushed, his heart rate was just going down.
Yeah.
So they take her into an emergency C-section, which, by the way, this is a long time ago. My parents did not have a lot of money. They were not at a good hospital, whatever.
Yeah.
Well, when they moved her from her bed to like the OR bed for her C-section, her epidural fell out.
That's unfortunate.
So when they go to
do?
cut her open, she could like feel it, not all the way because some of the medication was still in there, but like she could feel like the pressure and like it was painful. She said like my dad was yelling at them in there. And not only that, but back then they cut you differently when they did a C-section, but still like they literally cut my mom because it was an emergency from her belly button.
Yeah, they don't.
And then they wouldn't let her do a VBAC. with my other brother or me. So they had to cut down the same scar every time. And then with me, her staples busted open and they can't re-staple. So she had to let it heal from the inside out. So my poor mother has like, sorry, Mom, I probably shouldn't be telling this, but it's relative. It's relative to what we're talking about. So anyway, she has a scar like that big.
Yeah. Poor Mom. I'm sorry.
I know.
Moms are so tough.
They are.
Y'all go through so much.
Oh, I would be pissed if that happened to me. Like,
Yeah.
Yeah. I mean, it's cool to see
happens.
how like medicine, is evolving.
Yes.
And like, I mean, what surgeons do and doctors do now versus 30 years ago. Like, I mean, open surgery and like transitioning into the laparoscopic surgery was, becoming a thing. But I mean, there's still a lot of open surgery in some.
Yes, a lot of doctors still do not outdated, but just not the best, newest thing.
Correct.
Because that's what they're comfortable in what they were trained in.
Yeah.
Which I'm sure y'all encounter that a lot.
They're hard to encourage when they're stuck in their ways.
Yes.
And you're like, come on.
It's like when you go into medicine or any sort of nursing medical profession, it's like they tell you it's always evolving, it's always changing. So it's kind of surprising sometimes the doctors are the ones that are not wanting to change.
Well, I think it's more they just like to do what they know works for sure.
Right.
And
it's efficient.
And then they don't have to learn something new. And I'm like, come on.
They have a lot on their plate too.
We see that a lot.
Yeah.
I mean, well, especially surgeons who operate laparoscopically. Laparoscopic technique is a hard skill to master. I mean, straight sticks, like you don't have wrists. I mean, learning, you kind of are operating backwards when you're looking at that 2D screen. So it's just like, that's a skill, and when you develop and get really good at that skill, they're like, what? I'm not doing anything else.
Like, I don't know if I have time for that. Yeah. It makes sense.
So, okay. So induction versus just coming in, having the baby. Like, do you feel like a lot of moms prefer being induced or prefer to just wait till the baby's ready?
I feel like I work the most L&D in Abilene.
Okay.
And it's a little bit of a different culture here. I feel like we're a little bit behind the times and like kind of the granola natural birth way that the world is going.
Oh, really?
So,
okay.
So a lot of women do prefer induction, which I feel like makes sense because everything's controlled. There's a set date that makes them feel better. Yeah. And so it makes sense. And I think induction is necessary. Obviously, if you have like medical problems in the pregnancy, but just like wanting to have a baby, like nothing's wrong with your pregnancy, just wanting to have your baby on a certain timeline. I'm not a huge fan of that just because I see a lot of times complications that occur from, when your body's like not truly ready.
Not ready.
But then there's a lot of times where it works out fine. So, I mean, it all is fine in the end, but.
I loved being induced. I would do it for every baby, which I have a blood disorder. I have a clotting disorder, so factor V Leiden. So I had to give myself a Lovenox shot every week, and which is just a blood thinner. And so, I loved, like, I went in 2 weeks. He was 38 weeks. We knew went in 4:00 on a Wednesday, and it was just like, this is grand. My house is completely in order and cleaned. There were a couple of meals in the fridge stocked, ready to go. Like, everything was where it needed to be. It wasn't like, my water is broke and now my bed's a disgusting mess and I'm going to, it's like, it's just that would literally not be good for my mind. Yes. Like, I could not handle that. So I loved being induced.
The peace of mind, I think, goes a long way for moms when they're at the end of their pregnancy.
Yeah. Absolutely.
It's true.
Yeah.
So what was your favorite thing about being on L&D?
Oh gosh. I mean, it's super, what's the word?
Rewarding?
No, I was gonna say like, it's just typical, but you're around, like, this is, I feel like a canned response, but you're just around life, being born every day. It's amazing. Like the first few times, I think probably like the first 5 times I saw delivery, like in nursing school, and then after I cried, didn't even know the mom. It's just beautiful. It's so amazing. And so being around that every day is pretty darn cool.
Yeah.
And just the beauty of life and how those little babies are just very resilient. And even if they're stunned or they have to have a little bit of resuscitation after birth, they normally do just fine just because they're brand new and nothing's wrong with them. And it's just beautiful. So
do you have any particular situation or like story that always sticks with you, or like a patient that really like was touching, or it was a difficult case, or one that you'll never forget?
The first thing that comes to mind when I was brand new, like on my own, I had an emergency, like a stat C-section.
Okay.
Because the baby, we couldn't get heart tones. And that was like my first or second week on my own. And it was pretty terrifying just to experience it alone. Actually, I hadn't experienced that in orientation. And so like, you know what to do, but when you're in the moment, it's kind of scary. And so she was fine and the baby was fine. She was, I think, a German lady, like she was from a different country, but she has married someone here and then she had to go back. So I remember her because it was like when I was brand new.
Yeah. Like your response in that situation and how in your level of care, like how did you feel like help shape you, and like just why did that stick with you?
It's just scary because you grow used to just hearing a baby's heart rate all the time in your job and like what a normal heart rate sounds like. And so when you hear it decreasing and it's not coming back up or you don't hear it at all, it's just like scary in the moment, even though it's not your baby. It's still like just scary. And so everyone rushed in and helped and we got her back to the OR and her baby was fine. So that's good. But I think it like just I think every nurse needs that, like no matter where you work, just like that experience that kind of keeps you on your toes of like, man, things can really go wrong. And like, I need to have all my crap together and all my ducks in a row, like just for future reference. You kind of have those experiences when you're a nurse and it helps you become a better nurse because everything is just that much more prepared for the next time you have a situation like that. So that's probably how it shaped me the most.
That's awesome.
Yeah.
And I'm sure like with it being your first time, like you said, you know what to do, but me, I always blank in those moments. I'm like,
yes.
What do I do? Like, I know this.
Yeah. I was so glad, like, for all the people that rushed in my room to help me.
Yeah.
And that's what's awesome about nursing, especially L&D. It's very team oriented. Yeah.
Good.
And so they really, like, seeing how they responded helped me to know what to do. Cause like I was kind of frozen in the moment too.
Yeah.
So, yeah.
So cause also you also experienced some hard moments on L&D as well.
Yes.
Like, can you talk about some of that?
Yes. And how I'm surprised I didn't think of that before now. I was very surprised. I knew that babies dying would be a part of my job, but I was very surprised at how often it occurred and like how often I had to deal with it in my job. And so that was rough. I a lot of times like got assigned to those patients because I guess I'm just sweet and kind of gentle. A lot of L&D nurses are like rough around the edges. So I guess the charge nurses wanted me to take care of those patients. And that was hard. Like after a while, I was like, I need a break from this.
When like, you mean the patients that knew they were about to deliver a stillborn?
Yes. Okay. Or there's a lot of different scenarios that can happen. If like, sadly, moms can have miscarriages like really late and even like 20 weeks. And so the ER would send those ladies up to us, which is what should be done because the ER doesn't know how to, take care of a mom that's losing their baby.
Yeah.
Understandably so. So I had a lot of those situations too, where it was like a really very premature baby, but they still looked like fully formed when they came out. So it's really sad because even though they're not a normal baby size, like you still know it's fully a baby.
Right.
And so that happened a lot as well. Probably I saw more of those than I saw term demises.
Okay.
So yeah, but it's just like super hard because a lot of women think once you get past that 12 or 16 week mark, like you're good to go. And that is true most of the time, but sometimes it's not.
Was that more common than like delivery complications and a baby passing from that, or
yes,
how often did that happen?
So I would say that's more common than a baby like passing after they're born because our NICU team is like, we're really well trained. I love Hendricks NICU. They're level 4. They can do everything except surgery. on babies. And so if we had a high risk delivery, if the delivery things happen that were not anticipated, we could just call them and they would be in the OR really fast or in the delivery room really fast. And so they're just, and babies, they don't have chronic health problems. Like they're brand new.
Right.
So a lot of times the problem is respiratory and we can save that pretty easily. And then they do fine, they adjust. And so even if a baby is having a hard time or not breathing after birth or something's happening that's wrong, a lot of times it's not going to be
detrimental.
Yes.
Yeah.
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 So yeah, that makes sense.
Did you ever have a situation where it was like saving mom versus saving baby type thing? Okay, I think this is more in like shows and movies, but you know, like where there's like a, not even a complication, but like something is going wrong and mom's about to pass or baby's gonna pass. Did you ever have a situation like that?
Yes. So like the mom is a lifeline of the baby,
right,
in the placenta,
right?
You know, so if something's happening with mom, it's going to affect the baby. So normally it goes hand in hand. I'm trying to think. Yeah,
but you know, like in TV shows or movies, it's like, well, we have to save either the baby or the mom, and I'm like, why not both? So I was curious if you ever had like a real life scenario.
My parents actually did lose a friend who she knew that she had a, like, I don't know what her condition was, but like when she found out she was pregnant, it just was not a she was, which I don't know, is that
that can happen like with molar pregnancies where it's like it's not an actual baby, it's like this cell that's uncontrollably dividing in a way that's not making a baby, and so you get like the mom can get really sick and can have issues with that, and it's not a viable pregnancy, and so that would be like a situation where
so hers actually like was and like she passed
but still had the baby.
And then like he was a single dad.
I've never seen a mom die. Really? And I did L&D for 6 years.
Wow. Okay, that's what I was curious about.
Yeah, I've seen more babies die. Interesting. I've never seen a mom die.
Well, I mean, I
had a friend growing up too. Her mom passed like very shortly after she had her, but she had cancer already. So
yeah, that's what I'm trying to remember, if there was like a
diagnosis,
like what the diagnosis of her was that she didn't make it after the surgery or after delivery. But it's hard.
Well, now too, you can have babies later in life because of IVF and everything too. So it's like we did see stuff if moms were sick, like they had heart conditions and stuff. Like that was kind of nerve-wracking because you want them to be okay with all the fluid changes after having a baby and the blood loss and everything. But I never saw anything really bad with that.
Wow. So talk a little bit about your transition from, being in such a giving life and happy environment to
the complete
care.
Opposite.
Like it's like spectrum.
What made you transition to?
It sounds crazy, honestly. Like now that I think about it, doing it, what I did.
You're like from beginning of life. Now you're
like, I want change. Polar opposite change.
I'm kind of crazy. I don't know. I mean, I kind of know why I did it, but it is pretty interesting. I think critical care always like intrigued me. I did do clinicals in critical care when I was in nursing school. And so I knew what it was like, but it was like really sad. And I just like didn't want that.
Yeah.
And I think this is going to make me probably sound bad, but I think I was just tired of being like just the happy, like
bubbly Raegan.
Yeah.
She's the best bubbly, positive
smiling nurse.
person.
I was like, I think I'm okay. Like death doesn't scare me. I dealt with death even in labor and delivery. And so I was like it's a normal part of life. And I'm like, I think I can deal with it in the ICU. ICU intrigued me because of just how smart you have to be and all the, I'm kind of like OCD. So I know like the OCD nurses are drawn to ICU. And I thought about it for like 2 years before I moved. So I like really thought it out and I wanted to go to anesthesia school. And so that was kind of my plan of why I switched. But it was hard to switch because I knew that I would feel like a brand new nurse because it's completely different specialty. Yeah. But I'm glad I did it. I don't have any regrets.
When did you do it?
It's been a little over a year.
Okay.
I started April of last year.
Okay.
So, yep.
How are you adjusting?
I finally feel pretty comfortable taking care of an ICU patient. It's taken a while.
Yeah.
But I love the work. It's very like mentally stimulating. I think with L&D, I felt like I reached my ceiling of what I was going to learn. Mm-hmm. Obviously, I didn't know everything, but I didn't feel challenged anymore in L&D. And that was part of like why I was a little burnt out. And so I love that of ICU. It's like you have to be on your toes. Yeah. You work with amazing nurses and doctors, like just so smart. And it's the mental stimulation of it I love so much. Yeah. So, but I'm just a nerd, as we already discussed.
No, you're not. I think that your personality and like hearing you say that I was always given the patients that were I was often given the patients that were, dealing with, stillbirth or not going to have a happy time.
Right.
I think that like when you said that, I'm thinking that does not surprise me at all. Yeah. Why? Because your personality and your disposition, like you are the most positive, kind, sweet, loving individual, but like your capacity and way to love and cope, just like who you are as a person for people in those hard moments, like you bring that light and that positivity and love to those people. So
thank you.
Yeah,
so sweet.
So that's why I know you're the best critical care nurse. Like,
oh my gosh. Far from it. Because I work with so many good nurses. Like they're just incredible. But I'm thankful to be around the people that I am and learning what I am. It's awesome. Yeah. So it's been a good change.
So go ahead, Sarah.
No, you're good.
No, because this is kind of like a squirrel. Go ahead.
Talk a little bit about critical care and like what that training was like for you, and then kind of some of the just challenges that you face, like making that transition that you were excited to take on.
Gosh, there's so much to say.
Okay, what's been your biggest challenge so far transitioning?
I think it was a complete mindset shift for me of like as a nurse taking care of these patients, because all I had known was L&D. And I worked a lot of triage in L&D, which was like ER for pregnant patients. So the ER is like bottom line, like quick diagnosis, like you figure out what's going wrong and then you treat them. And it's not as much about the details. And I think, so I was used to like that way of thinking as a nurse. And then, I don't know if this is going to make sense. I'll just let me know. And then going to ICU, it dawned on me one day of like, I just need to have a more careful mindset. For example, if we had a patient in L&D that was just coming in to get something, they were having too many contractions and we needed to hydrate them. It wasn't a big deal. So if the doctor ordered a liter bolus of LR to hydrate them through an IV, we'd get that in, say they want a second bag. If you went over a little bit of fluid for them, it's not a big deal because they're healthy normally, they're young women, and they're going to be able to, it's going to be fine. So stuff like that of like, generally things work out okay. In the ICU, it's completely different. It's like a difference of 250 milliliters of fluid can make a huge difference for someone that's not supposed to get it if they have heart failure. And so like just getting used to like, I had to make myself slow down when I was working and be like, okay, these patients are very sick. And like things that I wouldn't notice right away that when my preceptor would help me to figure out of like, you need to pay attention to this, because I just would kind of gloss over it. I had more of a like bottom line mindset as opposed to like all figuring out all the details and kind of treating the details of the patient, which is very important for ICU patients. Does that make sense?
Oh yeah. Absolutely.
So I was like, I have to completely think about nursing differently.
Yeah.
Like, that was kind of hard.
What's been fun about that though?
Just nerding out on all, because ICU is like, you literally manage and perfect every body system.
Yeah.
Right.
Because you have to.
Yeah.
because they're so sick. And so like, it's really fun just
Did you whip out
on that,
all the textbooks and when you made that transition, were you like, I'm only working this region. I'm only really dealing with this. And like, now I've got to think of this, and this. Like, yeah.
I bought an EKG book because I'm like, I know nothing about the heart.
Oh my gosh.
So I did read that before. I was terrified of my lack of knowledge. Yeah. Because a lot of nurses, they go into med surg or they do some sort of general nursing to where you get kind of a general idea.
Yeah.
And I just had nursing school knowledge and L&D. And so,
you learn those things like in your undergrad courses too. So I was a BIMS major. So like,
oh my gosh,
anatomy, phys, blah, blah, blah. But like, I don't remember half of that stuff. Like every once in a while, I'm like,
to retain.
I should probably go back and fine tune. Like, I don't really use it these days, but still, like people. Sometimes though, I'll be talking to like doctors or we're on the pod and somebody's talking about something. I'm like, dang, I wish I could remember that. But
Need
a little refresher.
You're not actively practicing,
no,
and like exercising your mind in that
That's
way
why it's so
every
important.
day. I mean, you do lose.
Yeah.
You know,
it's not possible
to
retain all that.
Everything.
I always say I just used to feel like a huge genius, like in college, and now I'm like, I'm kind of dumb. I'm not, but I'm smart in other ways.
Yeah.
I'm not just a book nerd anymore.
Like people with photographic memories, I'm like,
that
is so awesome.
I know.
I mean, because you just physically can't forget. Like it's just all right there, like a book, you know, at all times. Like whatever you want to go back through, and oh my gosh.
Yeah, but it's like what you said. It's like I've heard older people say to me, like the older you get, the less you realize you know.
Yeah. What did Nick say, your uncle? He's like, you're a lot wiser, but you're actually a lot dumber. However he said that. Yeah, I mean, it
actually makes sense.
True. Yeah.
Yeah.
That's so funny. So when you transitioned, what was the support like from the current staff and team, and how did you feel like they just kind of took you under their wing and were like, baby Raegan, let's go.
They were so great. Their educators are amazing. They have 3 or 4 educators and they're awesome. Really? I like helped in the delivery of one of the educators' babies. So she knew me. It was cool to like kind of have some familiar faces. I knew a nurse there because I worked with his wife on L&D. I'm pretty sure he got me the job down there. And so very supportive. Hendrick is really, the nurses people that work there are just amazing and supportive. I had a great experience. Yeah.
That's amazing.
So. Good. Okay. So a little birdie told me that you've done some travel as a nurse as well.
Yes.
Talk about that a little bit, because we haven't had anyone talk about it. And I feel like people don't really recognize what all it takes to like do travel nursing and what all it entails.
Yeah. I don't even really know how I got into it, except that my friend that I worked with at the time wanted to travel, and she somehow
convinced you.
Yeah, got me to do it with her.
So you did that as L&D?
Right. I haven't done ICU.
Okay.
Traveling. I did L&D.
Where have you gone?
I went to Odessa and Fredericksburg, Texas. So I didn't go out of state, which is kind of sad, but yeah. You definitely have to be very confident in your skill set because they basically, you don't get like any orientation hardly at all when you travel.
Really?
You get like maybe a day or 2 and you have to learn like their whole charting system that's probably different than what you've done.
The hospital itself.
And and like where supplies are and everything. So it's a little disorienting. Like that's why I wouldn't do travel nursing for ICU at this point, because I'm not confident enough. I'm still learning.
Yeah.
I think you have to be very confident and like sure of your knowledge base and your specialty that you're in to travel. That's just my opinion. But I'm really glad I traveled with someone because we kind of had each other's back. And a lot of times the nurses that you're working with, they know you're making more money than them. And you're a new kid on the block. They're not sure what you know. They're not sure if they can trust you. So it's like hard. It's kind of hard socially too to work with new nurses like that.
So do you feel like they're not as open to
definitely not. No. I mean, I'm sure they're glad for the help.
Yeah.
That like you're helping them have better staffing, but
yeah,
they're very closed off.
So how do you bridge that gap for you? Like, how do you work to try to be like a team player?
Wait, also, how long are you typically like there?
Contracted.
Yeah. A typical contract is 13 weeks, which is about 3 months.
Okay.
And then you can renew. So some people love the hospital they stay at. They'll just keep renewing.
Yeah.
And they'll be there a year, even though each contract is 13 weeks.
Okay.
So Odessa paid really well. That's why we went there. Because no one wants to live there and be there. That's why they pay so well.
Nobody wants to go to Odessa.
Yeah.
No offense, Odessa. Sorry.
Right. It's pretty. It has some beauty. Like the sunsets and sunrises are really pretty out there. But that's about it for me. I don't remember what we were talking about.
Oh, how do you bridge that gap?
Yeah.
I think you just have to, in the nursing world, like you just have to prove yourself when you're with nurses you've never worked with before. And that just happens with time.
Yeah.
Once they know you're not an idiot, they kind of are more receptive and they like you and they'll talk to you.
Yeah.
And so it gets better. I'm such a people person, so that was always uncomfortable for me. Like,
yeah, I bet.
People ignoring me or like just being rude. I didn't like that.
Yeah.
Because
you're such a nice person. Like, how does someone be rude to Raegan? Nobody knows. But yeah.
It can be that way though.
Yeah.
Like we run into it too as reps of like,
for sure.
Oh yeah.
Especially if you're at a new place.
Like,
then you walk in and the circulating nurse or whatever. And thankfully I go to one place a lot is where I'm at mainly.
Good.
So like I know everybody there and like,
awesome.
But I can tell the second that like a new rep walks in or a new nurse too.
Yeah. It's an intimidating factor. Like
it is.
When I like kind of first stepped into like my current role, I mean, it was very like, I don't know. It's nerve-wracking.
I think also too, though, when like a lot of nurses are women, and then it's like women against women, and yes,
kinda
women
catty.
are hard on each other.
That's what I loved about going to ICUs because I never worked with male nurses in the L&D.
Yeah,
and it's a good dynamic, I would say. Like there is less drama in some ways. It's a little like,
you're like, I don't know. Wait a second, do I take that back?
Yeah, I'm not sure if I want to get on that path. But
oh god,
it's great to have them kind of break up the cattiness of women.
Yeah.
And then they're also ICU is so like physically demanding, so it's nice to have guy nurses who are stronger
who can
to help you. Yes. Yeah.
That's true.
So
yeah. I don't know. It's like I try to at the hospital. I'm like I don't want no problems. How many? Like I'm just a happy little
me too.
Like clam like this all the time because I don't know. I just don't see the benefit in like being judgy to others and like or whether they're new, whether they're established, whatever role that they're in. It's just like, hi, I don't know. I'm just a friendly person, but I think like especially in the hospital healthcare setting, I mean there needs to be like more teamwork and like togetherness,
absolutely.
Not
I agree.
Absolutely.
So I don't know.
I'm
sure I know you foster that so well. I know you foster that so well, but
I don't really even know where it comes from. I don't know if it's like a protection mechanism of like, oh, this is my space. Like, don't come in here and mess it up or whatever. But or I think some people get protective over like their doctors that they work with and like I don't know. It's just a high
in our
pressure.
industry, some of it's like
there's high stakes.
The stealing business aspect. So I understand like they're being concerned. Well, I mean, but I think
medical field is hard though. It's hard to feel because my mom talked to me a lot about that when she started, like just feeling that people treated her not in the best way. And I think it is like kind of what you were saying. And then like it's also about like how smart are you?
Correct.
And
that's where I was going with that actually.
Yeah. You kind of have to prove yourself to everyone because it's the
You do.
smartest of the smart people.
Yeah. Well, and they
that you
can be
work with.
such critical situations. Like you hope that everybody just knows what needs to be done, when it needs to be done, how it needs to be done, and like to execute and work together. But like when you don't know, it is one of those like, is this about to like, are you about to put me in a bind? Because like you can't do your job type of thing.
Yes.
So I
especially
do.
for physicians.
Yeah. So I do get that. But
yeah. Kind of high stakes, high stress kind of breeds that environment.
Yeah.
Makes sense.
So with travel nursing, first of all, like because I think that there's people know that, oh yeah, that's a great opportunity to see new places.
Yeah.
You can make more money. But what would you say are the top couple of like upsides to travel nursing and what you learn in that side, like in your career and profession, and then downsides?
For me, it taught me flexibility, like especially in Odessa. Oh my goodness, that was a baby factory machine, that hospital.
Really?
People were just blowing out babies.
You oil men need to chill out.
Yeah. Well, it's like closer to the border, so a lot of
immigrants.
Okay. Would to come and deliver. So yeah, I couldn't, I'm a little bit of a perfectionist, like my ducks in a row. I had to let go of some of that because it was just so fast paced and
really?
Yes.
It's a shocker.
It's a shocker.
Yeah. That was the Wild West, truly. So it taught me flexibility. The money is very nice. Like that's how I was able to save up money to buy my house. So it was a huge blessing.
Yeah.
Downsides. I don't know if there are that many downsides. Like travel nursing is pretty awesome. I stopped doing it because I was kind of lonely doing it, because I stopped traveling with my friend that I started with because she ended up moving to Amarillo. And so I got a little bit lonely. It's just hard to not be around the people that you're used to in your town that you live in.
Yeah, and you're in a new place all by yourself. And
if they're not super welcoming all the time,
right.
It's like,
who do you go hang out with?
When you're off.
Go sit at a restaurant by yourself.
I mean, Fredericksburg was fun.
Oh, I'm sure.
Time. You're like, screw you guys. I'm going on wine tour by myself. I'm going to try all the wine.
That was the best place ever. I love that town.
Oh my gosh.
Well, how do you feel like, though, like it shaped you as a nurse, though? Because I could imagine that kind of being, for me at least, if I was going to different places and they do things different ways, like you could, I think it's kind of cool. You probably got to learn so many different ways of doing things.
Yes. In Fredericksburg, they were way more natural birth oriented. Like they had tubs in almost every room, which that's not how it is here in Abilene.
Oh, wow.
For women that wanted to labor in a tub. And so that just gives you an idea of kind of more the natural side. And I love natural birth. It's amazing. Really? I mean, everyone's created to have, your bodies are just meant to have babies. So it doesn't need all the medical help, even though it is needed sometimes. So kind of growing in that way of all the different, I feel like Hendrick tends to be more of the medical, tends to treat pregnancy like, more like medical condition, as opposed to like
natural.
Yeah.
Like doulas and midwives. And
that's a hard thing.
What does that look like, actually? I'm curious. Because do they come in to the hospital? Do the doulas or midwives deliver? But then how does that work? Do they have privileges? Or
typically, that's typically at a birthing center, right? With the doulas and midwives.
Do we have a birthing center here?
We do. We do. Sometimes, but we don't really have an association with them. I know in places like my friend delivered in Dallas, and there's a lot, I think in bigger cities where things are more progressive, there is a better blend of like, okay, the medical and the natural sides. Because when my friend delivered in Dallas, they had the birthing center, but it was attached to the hospital, like this long hallway that you would walk.
Oh, that's nice.
They could get there pretty easily if something happened.
Yeah.
So we would still have people come in from birthing centers here if bad stuff happened, but it's not as convenient. And there wasn't as good of a rapport with those birthing centers here. Yeah. But I can only speak for here, really, because that's all I've really known. I think in more bigger cities, it's probably a better
dynamic
relationship.
Honestly, I kind of wish that a lot of the hospitals were like the one in Fredericksburg. Like, why is it not more geared towards like the natural and like, hey, let's intervene where we need to? Because now you have all these women going to like these birthing centers, and there are some like even in Dallas that are not connected, and then it's like you run the risk of like, if something happens, you're not close to the hospital. It's like, why are we not just allowing a space for women to come in and like, because I feel like sometimes women go in and like say they don't want an epidural and they want it natural and stuff. And I think sometimes they feel like pressured,
right?
Depending on the staff and everything, but they feel pressured to like be forced into like the medical side of it. And it's like, I don't know.
Yeah.
We could just merge the two.
Right. Which I think there are places that do it better.
Yeah.
Is what I'm saying.
And
like,
so
I think we're getting that way.
You think that's where it's going?
Yes,
Okay.
I do. Because more women are interested in natural birth now.
Yeah.
Like, it's just like kind of where medicine's going now. Like, of holistic, I would say. And so I think it's getting better. I think.
Well, that's good.
Yeah.
Yeah.
I think just certain places are going to be more ahead than others. So
for sure.
Yeah.
Yeah.
But yeah, you have to break away from change is difficult, I think, even in medicine, kind of what we were talking about earlier. And so you have to be open, doctors and nurses, to different ways of thinking, or maybe even things you weren't trained in, but are still a valid way
to
have a medical experience. Yeah. It's kind of.
I mean,
you feel, this is a curious question, do you feel as though the medical, like the physicians first, introduce new techniques, ways, or just progressiveness, or like the hospital staff, nursing is kind of the ones to start seeing these are the more efficient type of ways or technologies or things that and where it's like the physician more so having influence on you guys, or you vice versa.
I think it depends on the physicians, because nurses are advocates for patients and we advocate for them like we can, but at the end of the day, the doctor is the one that gives orders, and there's what they want goes. So I think it really depends on the doctor and how. There's a lot that goes into it. How they were trained, if they're a DO versus an MD, how open they are, to maybe like less medical intervention. It just really depends on the physicians. In my experience.
Have you ever had a time though where you've maybe experienced, not even with like the natural, but just in general, where you've experienced something with patients and you've brought it like to your physician's attention, and maybe they've changed a way they do something or something they say or anything like that? Have you like helped influence that, I guess?
That's a good question. I can't think of anything specific, but there was a doctor I used to work with here. I don't know if we can say names since everything's so close to home. Yeah, there was a physician I worked with, and he was very open, just not set in his ways. Like he was open, just really great with the women that he took care of, and like really listen. And so I always felt like I could talk to him and ask him like, why did you do that? Or like, why wouldn't we do this? Kind of have more of a conversation as opposed to it being like a one-sided conversation where you're just like following orders, or that you're not allowed to say like what you think, And so it's nice to have those relationships. There's 100%. Plenty of doctors out there like that. It's just kind of finding them. And I really appreciated him when I worked with him, because I felt like I could bring up stuff to him.
And I think you probably learned more and understood more of like the whys.
Yeah.
Yeah.
I like those kind of guys.
Oh yeah, me too. Yeah.
Good questions.
Okay. So let's talk about CRNA.
Oh my gosh.
In your future to come. I know it is. I'm so excited. Okay, hopefully. So what's the prerequisites for CRNA? What made you want to pursue that in your future? Let's talk through it.
So in L&D, I worked with CRNAs because we are in the OR so much with C-sections, and they're just awesome. Like, they're badasses. Yeah. They got all the big drugs. They know how to save a patient's life. Yeah. And so I just thought they were really cool.
Can you explain like what the big difference is between like a regular nurse and then becoming a CRNA? Like, what does that allow you to do?
Okay, so you're a practitioner. You would it would be similar to a nurse practitioner or PA. You work under a physician, but you are an independent practitioner. You can practice medicine under a doctor. Mm-hmm. So,
and for those who don't know, CRNA is certified registered nurse anesthetist. So it's in the anesthesia side of everything.
Okay,
yeah, you work under an anesthesiologist, a doctor.
Okay,
but to be a CRNA, you have to first be a nurse, and it requires ICU experience. I think just a year.
Is it just a year? Okay.
I think just a year, but I'm like, I want to have more than that.
Yeah.
Just be more comfortable. Then you have to take the GRE. You have to have certain
Which
prereqs.
Is what?
Oh gosh, I hate the GRE. I took that thing.
What is that?
That's like the biggest barrier, I feel like, for me. I'm like, oh, I don't want to take that.
It's a test. Like
an SAT, but for a graduate degree.
Oh, okay.
I had to take it for vet school.
Okay.
That I didn't get into, but anyway.
How'd you do on it?
I had a decent score. I took it, I think, a couple times, but
yeah,
I don't know. Thinking about taking it now, I'm like, oh heck no. But you're already gearing up to go back to school, so good for you. Me, never going back to school again.
Raegan's like a good study bug, though. Like you just are like I don't know.
I like school.
Yes,
I like learning.
So
I like to learn. I just don't like it in a school environment anymore. I'm like, I'm never going back to school again.
Yeah, I mean, more power to you. But don't do it.
Good for you. So what makes you nervous about like thinking about that? The GRE. Okay, wait. So backtrack. You were saying GRE and then sorry, I interrupted.
Yes. I think you have to take I never took statistics.
Oh Lord.
You didn't take stats?
No, because A&M nurse school didn't require it. That's why I said I put all my eggs in one.
Sucks.
Yeah, I know.
Oh, my degree plan required it and it was awful. Let me tell you. I had a
I'm doomed.
Like I had a visiting prof for that class and God love him, but I couldn't understand him. Yeah. And then his writing on the board was like chicken scratch and I was like, okay, I can't read what he's writing and I can't understand him. So I don't even know how. This was when it was like COVID and so it was like it transitioned to online, so my tests were online, and I was just like,
"Oh no,
that's rough."
I could not do that class online.
Me either. And that sort of math.
Oh my god!
Well, then we'd get on Zoom.
I mean, you saw me in algebra 2 in high school. It's like you're doomed.
Well, then we would get on Zoom, and it was worse. So like, I would have to basically go on YouTube and like watch videos on stats. But anyway, this is a whole
like
tangent.
Teach yourself.
But yes, teach myself because I was
very
like,
scary.
Or ask I had a girl in my class that I knew and I'm like, did you understand what he just said? I feel bad saying that, but seriously, it was a struggle.
Yeah.
Anyway, though, you have to take stats.
And math is not what I'm good at. So that makes me nervous, but I know I can do it. Like it'll just take some.
You'll be
it's
fine.
Just one semester.
Intentionality.
You don't have to take like stats 1 and 2, right? It's just like one.
I think it would just be one class. Yeah, like
you can do it.
So
that's good.
Yeah. The main thing is like I'm like I don't want to take the GRE because I thought about getting my doctorate in nursing like a long time ago, and so I started studying for the GRE to get accepted into that school, and then I decided I didn't want to do that, and that just felt hard. Is what I remember, and so I'm like, it's a negative feeling. I don't want to. But it's okay. It'll be fine.
Yeah.
There's so many resources nowadays.
Yeah, my mom made me do this like GRE prep thing, and I'm like, "Are you kidding me?" But
it helped. It probably helped. Yeah.
Mm-hmm. Do you think leaning into, the hard side of your career has just helped you develop this mindset? Like, I can do hard things. Like,
for sure,
this isn't. It may be hard, but it's also temporary. And I can master it.
That's a good way to put it. Like exactly how you put it. And the ICU, sometimes I'm like, that shift just kicked my ass. Like, and I feel that so often. So it's definitely like a resilience mindset. And so I'm really excited for the potential of going to CRNA school. I think it just feels like this would be my dream. And so it feels like kind of scary or kind of far out there at this point. Yeah. Even though like I'm working towards it, you know?
So when are you planning on like applying or what's your ideal goal?
So I think I want to get 1 more year experience, like maybe apply and like get accepted by the time I've had 2 years of ICU experience. And it's pretty competitive, what I've heard. So
in that time frame, do you also have to take your stats class?
Yes, I would have to take it beforehand.
Okay.
So I probably need to get on that. I need to get certified. So in nursing specialties, you can get certified in your specialty, which just means you're really competent at what you do, basically.
A test? Is it a test? Okay.
And so I did it for OB, and I need to do it for ICU. So I'll probably do that first, and then I'll look and start taking the prereqs that I need for CRNA school.
We're just reminding her of all the things that she has to do.
Sorry, we're having you form your checklist.
That's good. I need it.
Well, that's exciting. Okay, so walk us through what the CRNA program looks like. How long is that?
I think it's 3 years. Okay. So I need to have a plan for
and it is now a doctoral program, correct? So my cousin's husband went through CRNA school at TCU.
Nice.
And he was at what's the Dallas
Parkland
Parkland ICU, and then he went to TCU, and it had, I think, right before he went through the program, it changed from a master's program to a doctorate.
Yeah, that's been a recent change.
So, and that added another year, correct? Because it used to be a 2-year program.
Okay. I think that's right.
Okay.
Yeah, from my understanding, it's 3 years. I don't know how I'm going to work and do that. So we'll see what happens. Or maybe I just need to.
Do a lot of people do that?
Well, then you still have your ICU, you still have your job.
Yeah. I think the only way it would work is being PRN at your job.
Yeah.
So I need to have a plan for saving my money and everything, which I have a savings, but I just need to get a better plan for when that time comes.
Yeah.
So, but a lot can happen in between that happening. So
you could maybe go part-time and still I don't know, just live real cheap for a while.
Yeah, just adjust.
Yeah.
Heck, do you want to go in person, or is it online, or what does that look like?
It depends on the program from what I've looked into. Okay. Some of them are hybrid, part of it's in person, part of it's online. So I guess it depends on where I get accepted.
Okay.
But yeah, I think it's at least 3 years. It's a doctorate program. And then
do you know what some of the course curriculum is like in the program?
Not really.
Okay. I figure you probably learn that when you go through it. So
yeah. I think the biggest thing about being in the ICU before you go into it is becoming familiar with the drugs that you're going to be using as a nurse and anesthetist.
Yeah.
So that's all I got to say.
So awesome.
Yeah.
So do you want to travel CRNA, or do you want to be home-based CRNA?
I probably my personality just tends to be I like to be planted where I'm at and have a community. So I'll probably just be where I'm at. Yeah.
Yeah. That's good.
But yeah, a lot of ICU nurses, a lot of the ones I work with, they want to do it. So I think it's a pretty common thing.
Yeah. For
ICU nurses. So it sounds competitive.
To transition into that. Yeah.
Yeah.
So what is the main difference between CRNA and nurse prac? Is it just more on the anesthesia side for CRNA, or what is the difference?
Yes. So CRNAs are anesthesia providers. You're going to be in the OR all the time. That's your job.
Okay.
You're in the OR doing surgeries. CRNAs are the ones at the head of the bed, administering medications and making sure the patient's staying alive during surgery.
And staying asleep.
Yes.
Yeah. Don't we?
Okay. Yeah. Exactly. Yeah. That's very important. Yeah.
So you're
don't wake up right now. Actually, let me rephrase. Wake up later. Okay, when this
in
is
the
done.
right time.
Yeah, exactly.
So you're basically like an anesthesiologist, just
yes.
But you have to do it under a doctor.
Yeah.
But you can be in there by yourself.
Right. You're an independent practitioner.
Okay.
Yeah.
So a lot of times in surgery, I'm sure you've noticed it's the MD anesthesiologist will come in and help prep and start
the case.
And then the CRNAs are the ones that
take over.
Yep.
Yeah. Oh, I never have.
Really? It does depend on facility to facility, and lots of surgical center or surgery centers. There is I don't know if they don't have to have them on site. I don't know the logistics of that, but I know that there's always one nearby.
Yes, there's a doctor that's either on call if they're not there or close by to be able to assist. If
What's the real difference?
Crazy happens.
of an anesthesia? I mean, besides the fact that you go to med school, okay, but in your day-to-day, what you do of CRNA as a CRNA versus an anesthesiologist, how's that different?
So like nursing and medical school is pretty different, I guess. I mean, I haven't gone to med school, but like it's a different line of thinking. Nurses are always like holistic, caring for the whole patient, and doctors are more science. It's just a different diagnosing, and they don't care as much for the patient. The nurses have that more, that hands-on care. And so, but they've got all the brains to really know what's going on. So I guess on a day-to-day basis, we'd really work together and do the same thing, but they are doctors. So they have a little bit higher of a training, I would say.
Okay.
Is there anything that they can?
Yes.
Okay. Yeah.
Like we can, like I could intubate.
Okay.
If I was a CRNA, like I could intubate someone just like a doctor could.
Okay. I was going to say, is there anything that they can do that you cannot do as a CRNA?
Not that I've seen, because I've worked with a lot of CRNAs.
Okay.
So.
Okay.
That's freaking cool.
Yeah, it's pretty crazy. Sometimes I'm like, am I sure I want to do this? It sounds like a lot of responsibility, but
you're going to crush it.
Well, hey, I feel like we need some more CRNAs in Dallas. So if you ever feel like moving to Dallas.
My brother lives in Dallas. So
really?
You never know.
Do you follow Olivia Reeves on TikTok?
No. Oh that name sounds familiar though.
You've got to. She's literally like one of my favorite TikTokers
ever.
But she's a CRNA.
Yeah.
And she just is, I
think I might know who you're talking about.
She has her own,
like I've seen
she has her own like makeup palette. And
I think I know who that is. I just didn't know the name.
And she like talk about her job. Love it. She has like turn the five head into a four. Gotta get that juicy lip. But she'll like do her makeup while she's talking about her day to day. Yeah. And like,
hey, shout out Olivia Reeves. We'd love to have you on.
We'd love to have you on.
Sing.
We can come to a Get Ready with You on the podcast.
Yeah.
Yeah. She's,
I think I know who that is. I think I just didn't know the name.
Yeah.
Yeah. Cool.
That's so exciting.
So what else is coming for you? That's it?
That's pretty much it. I mean,
she's like, that's a lot of my plate.
Yeah.
So we talked about your 5-year plan. Let's talk about your 10-year. No,
right. Oh my gosh. I don't have that much of my life together.
Me neither.
But yeah.
Girl, me neither.
That's awesome. Okay. Few questions. In what way do you hope to leave a mark on your future patients as a CRNA or do with your current patients?
Yeah. Great question. I love that nursing gives me the ability. It's kind of like a ministry for me. Mm-hmm. Faith is an important part of my life. And so loving on people is what I love to do. And it's a great way to love on people in a practical needs sort of way, because you're helping them get better and heal. And so it's just I love that my job, it gives me an opportunity and a position to just do what my heart loves and care for people and love on them. So that will always be like, it's like, I'm not obsessed with, some people are like really into nursing and like want to be educators and teach other nurses. And I don't really want to do that because like, I don't love, and it's like, I don't have a heart for that. I love that nursing gives me the ability to just love on people. And I think all nurses are like that. So, but you have to, it's easy to get burnt out of that too. So you just have to be careful and kind of learn your way through it. So I think I had a lot of anxiety at the end of high school going into college, and I struggled really hard. And I had some people, like I had a counselor that really helped me get through that time. And I felt very vulnerable, and she helped me. And so I remember being like, I want to do what she did for other people. Like, they're in a vulnerable place and I want to help you. Like that's such an amazing thing, like for someone to trust you in a vulnerable place. And I feel like, especially in a hospital, like those patients are definitely vulnerable, and it's just like really honoring to be able to help care for them and get them better. So,
and even though it's such a big industry, it's something that, I mean, think about all the jobs and people in the world that don't have connection to or don't do anything in this industry. So it becomes a scary place as well. Oftentimes for them. And so like, that's amazing.
Yeah.
Oh, I love it. I love it.
Yeah. I'm just a softie.
Yeah. She has just the sweetest heart. What advice would you give to nurses or to nurses wanting to pursue a higher level of education, whether nurse practitioner, PA, CRNA?
Whatever you decide. I would just say it's hard work. You cannot be lazy. Not to say there's not lazy nurses, but I think in nursing school, it's like definitely glorified. Like what you do is glorified, and you just get in this mindset of like, this is the best thing ever. I'm helping people. And it's a lot of grunt work, a lot of cleaning up poop, and a lot of things that are nasty that you have to deal with of just bodily functions. And it's hard. It's physically taxing, especially labor and delivery wasn't that way so much. ICU is definitely more that way. Yeah. And there's some nursing jobs that aren't as hard as ICU, like as far as all the
physical demands.
Physical demands and bodily fluids that you have to deal with. But
I would not do well in that.
Yeah, like I don't know.
Yeah,
I don't know how the circulating nurses sit there and put Foley's in all day. I'm like,
you're like, I'm good to stand a few feet back.
Like I'm not phased. Like surgery doesn't faze me. Like I mean, but throw up.
There's little things that get you.
Oh my gosh. I think like I don't know, if I had like a pin to put on my nose, I could maybe deal with like the fluids of, having to, clean a patient.
Right.
But I don't know. Yeah. The throw up's really the only one that's like, I can't do this.
That's like such a thing for like nurses, depending on whoever you are. Like every nurse has the thing they can't deal with.
What's
like,
yours? What's yours, Raegan?
I mean, I can deal with it, but I just like sputum, like respiratory secretions.
His face is like, no.
Sputum.
It's a gross word.
Does it smell?
Oh yeah. I mean, there's all kinds of nasty stuff that can grow in your lungs. So that's my ick. But
yeah, see, it's really the smell factor for me.
Yeah.
That's what it will just send me over.
I think certain people that can't deal with that kind of stuff like shouldn't go into
nursing,
the medical profession. Yeah,
that's true.
Because my youngest brother is like that, and he thought about becoming like a paramedic or nurse, and I was like, I don't know that you can do it, because he'll be like dry heaving at the sight of blood, or like he'll pass out. Yeah, you have to be able to deal with it.
No, literally, as a mom, like when my child throws up, I throw up. And TMI world, but I also pee myself. Like, and not just like a little. I mean, it just is.
Me too.
Because ever since I had a baby, I just like there's no.
Well, if it makes you feel better, I haven't had a baby yet, and I pee myself every time I throw up.
Every time I throw up, dude. Like I am like full-fledged hard launch, crossing my legs, like gripping with everything I can to not soil myself. But I just can't. And so like I would not do well in those situations. I'd have to bring 5 pairs of underwear and change of scrubs to work every day
in your locker. Yeah.
Yeah, it's not. So bless you. Thank you for what you do.
Thanks. Yeah. It's okay. It's not too bad, but you get used to it.
Yeah.
But yeah, I think you just have to be a really hard worker. You have to have a great work ethic. And yeah, I would just say it's like pretty hard work, like brain work, just having to think through things, critical thinking, physical labor, the emotional part is hard too. So it's just like, it's way more. Nurses are the middleman for everything, like between families and doctors and PTOT, social work. Like we're always in the middle between the patients and the other specialties that care, and the multidisciplinary team that care for the patient. And so it's a pretty big job. Like just it involves your whole person. And so I would just say, if you're ready, to take on the challenge of that. And then having good outlets, if you're a healthy person or have healthy habits, to be able to deal with the stress of that helps too. Be able to have outlets when you're not working. Yeah.
Absolutely. What are your outlets?
Definitely working out.
Yeah.
My dogs are a huge thing for me. Just spending time with them and walking them is like relaxing for me. I like to cook. That's good
for you.
Sometimes. Sometimes I just like to lay in bed.
Yeah.
And watch TV.
Yeah.
But
there's nothing wrong with a little bit of bed rot.
Oh no.
No. Not at all.
You gotta have a
little rot sesh. Every once in a while.
It's part of life.
Okay, let's do some rapid fire questions.
Yeah, let's.
Okay.
Okay. Vitals check, okay? You ready?
I love the theme here. It's awesome.
Okay. Your favorite nursing shift snack?
Right now I'm on like popcorn and strawberries.
Oh, okay.
Like
together?
individually.
Okay. I eat peanut butter and popcorn together, which people think is so
that
weird.
actually sounds good.
It's really good.
Oh. Okay.
And then chocolate milk. I know that sounds so weird. And don't judge me.
It's like a Reese's popcorn.
Yeah. It's not the worst thing I've heard.
So, interesting. Okay.
Yeah.
Strawberries and popcorn.
Go to pump up song before a shift.
Oh gosh. I'm so bad at this type of stuff. I don't, honestly, silence in the car. If I'm really dreading a shift or like I don't want to work, I just drive in silence to work. I don't know. It's just like a mental preparation because you're surrounded by so many beeping noises and talking to people at work. I think I just
need the silence.
I don't know.
Okay.
There's probably a lot of nurses that have pump-up songs, but I don't think I have one.
Okay. Coffee or Celsius?
Definitely coffee. Celsius are very good.
They're so good, but they're
Coffee's my love.
Yeah.
My first love. Yeah.
Dang.
Are you a black coffee type of girl or
no?
You get it.
I can drink black coffee, but I don't prefer it, obviously.
Yeah.
What are you, a sugar and creamer or just one?
I like cold brew. So I like 7 brew. I'm so addicted right now.
What's your 7 brew order?
I get cold brew with like brown sugar, cinnamon flavor in it and some cream. It's not too sweet.
Okay.
It's good. I don't like the super sugary drinks.
Yeah, everything I've ordered from there, I must be doing it wrong because I'm like,
it's too sweet.
Oh my gosh, yeah. I have diabetes.
Yeah.
Like immediately when
I give me some insulin.
Yeah. So
okay. Yeah. Gotta find the right thing there.
Yeah.
Dream vacation spot.
Oh, I want to honestly. Been really wanting to go to Italy lately. My friend just went, and I love wine. I'm like, and their wine is like supposedly clean, like cleaner than our wine, and you can just drink it all day, every day.
What does that mean?
It doesn't have like preservatives and additives like we do here. Like it's more fresh.
Okay. One thing you cannot live without doing a 12-hour shift.
Probably coffee. More than food, honestly.
Really?
Because I work nights.
Yeah.
So you have to have caffeine. One thing you could live without.
That's actually our next question. A night shift or day shift?
Night shift is just so awesome because the nurses are just so cool. Like, it's a different type of nurse that works night shift.
Okay.
For sure. Like, you don't have management around and all the people that are normally around during the days. So it's a little more relaxed it's just better. You have to kind of rely on each other teamwork wise because you don't have all those extra people to help like you normally during the day. So night shift is awesome. Just the teamwork and the type of nurses who work night shift. Yeah. Day shift is obviously better because of schedule wise, but I don't know. Like if I had to decide one right now, because I worked both, but I'm doing nights now.
Okay,
yeah, and I love nights. So
yeah.
Okay.
Yeah.
Nights.
Okay. I want to ask this one. One nursing supply you're unreasonably attached to.
That's a good one.
Okay, so I thought about this because I saw your questions beforehand. It wouldn't be a supply. I don't think I would categorize it as a supply, but we give baths every day in the ICU. Like patient has to be bathed every 24 hours just to like decrease infection risk on their skin and stuff. And I love giving baths and getting all the linens and fresh linens and everything tidy and like perfectly just neat on the bed. It just makes my life feel so much more organized. So that's probably like thing like I need to have a chance to like do a bed change on my shift because it just makes me feel better it makes me feel like the room's cleaner.
That's interesting.
Yeah.
Well, good.
Yeah, it's kind of a weird
thing. Sure, it makes the patients
feel
better too.
For sure.
Oh yeah.
I mean, whether they know or not,
bedridden and they haven't been on a bed in weeks. So It's important.
Oh.
Yeah.
Yeah.
But that would be like my supply. The
Okay.
linens.
The linen.
Yes.
Okay. One word to describe L&D and one word to describe ICU or for ICU.
L&D, I think happy. Happy is the word. Like it's a pretty happy place.
Okay.
ICU, I think control. Everything
Control.
is perfectly controlled in that unit, like down to the nth degree.
That's amazing.
Yeah.
Wow.
That was not the word I thought.
No.
What would y'all
I thought she was going to go.
Thought happy
I thought she was going to go happy, sad.
I did
Yeah.
like,
I mean, that's true too.
yeah. But I like that you control.
But I also feel like ICU is not always sad because there are times when patients make it out.
Better. Yeah.
So,
yeah.
Oh.
And sometimes like death is a good option if patients are just struggling and really it's like they're not living the way that they are. They're so dependent on intervention. And so it's like, well, when the families decide to let them go, it's like it's probably
they're
best for the patient. Yeah. So
Right.
Okay. The nicest thing a coworker ever did for you on a hard day. We're about to find out if he has some nice coworkers.
Yeah. Oh, gosh, there's probably so many examples. Okay, so I'll say this. It was a doctor I work with in the ICU here. So it's not like technically a coworker because he's my superior.
Yeah.
But I had a really hard shift when I was training because we were basically trying to keep this guy alive. Like he was max support on all pressors. Like we were basically just battling him being acidotic like constantly because we're trying to let the family all see him and we were waiting for family to get in town before they discontinued
life support.
Yeah, interventions. And so that was like just rough. And so I got like a respiratory gas and brought it to him and he was like quizzing me and I got the answer wrong. And I just felt like it's just like a discouraging day.
Yeah.
Like it was a lot of running around. Like we're literally just trying to keep this guy alive. And so, he was just like super nice and was like, you know what, Raegan, like, don't sweat it. Like we're here to learn. And he said, we practice on old patients. We practice so we can get it right when it's a young patient, because typically in the ICU, it's a different mindset. Like there are a lot of older patients and you feel better about death is hard, but it's
a little
easier to deal with when someone's older.
Yeah.
And so the fact that life.
Yes.
Yeah.
And so the fact that he just said that is like, like we're learning and we practice and we get really good at what we do so that we can save someone when it's really needed. Like someone who does not need to die, at that moment in time. And so kind of him saying that was just like a breath of fresh air. And I don't know, it just like helped me in that moment and helped me kind of just take the stress off of how I felt. And for him to like humble himself and just like relate to me, that's a huge deal for a doctor in my experience. Because I feel like I have a lot of experiences where doctors are just your superior and they don't try to like relate or like help you in a way of like that a friend would or a coworker would. So that was a big deal to me. He's awesome.
That's amazing.
Yeah.
Words matter. I mean, and
sorry.
That
I hate when that happens.
Words matter, and the attentiveness to, to other people, and being able to, relate in that way. I mean, it's huge.
And with that patient, it was like we weren't going to save him. We were just trying to keep him alive until family got there. So that was kind of the context of like why he said that.
Yeah.
Like, no one's going to ever get it all right, but you're going to learn and it's okay if you mess up.
Yeah.
So it was kind of like that. Yeah. I want to make sure that sounded okay.
Yeah.
I think it also makes you feel better mentally especially when it's coming from a superior, not just somebody who's like level with you. It's like, okay. Like,
well, especially because like in our fields, like we put, doctors on pedestals because they are like their knowledge and like what they can and do every day and have to manage every day is so complex for our level. Not that we don't do hard things, but so for them to have that like just understanding and being able to drop that guard. I mean, that's.
Yeah.
What's your I survived my shift guilty pleasure?
Taco Bell.
Oh yeah,
What's
girl.
your order?
I like their quesadillas and the cheesy gordita.
My kind of girl.
crunch.
My kind of girl.
See, that's awesome. I'm
Chicken
a
quesadilla, baby.
quesarito
Yes, so
girl, but now you can't get those unless you order them on the app.
Oh,
I don't have the
really?
app. Yeah, they won't make them. It's like, I know you can make them because I can come and pick this up if I were to order it on the app.
Right.
But the only food app, well, I have Starbucks, but the only other food app I have is Chick-fil-A. Like, I just refuse. I'm not going to be that person that's got 50,000 food apps on my phone. Like, no, I won't do it. And so I'm like, I never go to Taco Bell because I can't get the quesarito anymore.
So you won't download the Taco Bell app?
No.
Dang, that sounds so good. I'm like, do I get a quesadilla on the way home? No, I already feel so... It's okay. Anyway.
Yeah, their quesadillas are next level.
Next level.
They're so good. I probably couldn't make a quesadilla that good. So good.
That's awesome.
Sounds so good, though.
Okay. What is your mantra right now for life, for your career?
Just have fun. Like, I feel like I've done a lot of hard work in my life, and I feel like I'm getting to a spot where I'm stable financially and I can kind of just have some fun, and
I love that for you.
That's what I need, I feel like, because I'm a very like nose to the grindstone person. But I feel like I'm having kind of a transition in life where I'm like, you know what?
Just have fun.
Yeah, like life's not as serious as we might make it all to be. And I'm kind of learning how to enjoy life more right now. So
I love it.
That's awesome.
That's why I'm friends with Sarah too.
I'm a little wild.
She's the fun one. For
Whatever. You are so fun. Oh my gosh. I love my Raegan.
Well,
just thank y'all for having me. And I think what y'all are doing is awesome. Just giving people in the medical field a voice to really talk about how things are for real. And I hope y'all are just really successful and enjoy the process in the future.
Well, thank you for your vulnerability and just sharing like your experience and a little bit of your heart. First of all, there's so much to this amazing person that here. Like, I mean,
you're amazing.
We didn't even get to touch on it, but on everything. But thank you for everything that you do for patients and your care.
You're welcome.
Yeah, and I can speak firsthand.
And thank you for coming.
She's the best nurse.
And thank you for coming on and sharing. Yeah. Like, we really appreciate it because you touched on a lot of things that people don't know about, especially like traveling and
L&D.
So L&D.
Yeah, there's a lot that goes into L&D. Everyone's so curious about it.
Yeah. It's so fun.
Well, it was really fun talking about it. Thank y'all.
And I'll be praying for you and your CRNA school and everything.
Thank you. I need all the prayers.
If you want, we'll also be your accountability partners and check in on your checklist.
Yeah.
Okay.
How's that checklist going?
I need to write down everything we talked about today.
Anyway, thanks, guys. Tune in next week.
We'll see you soon. Bye.